Welcome to the OEBB Open Enrollment presentation with Moda Health. Here at Moda, we are proud of our partnership with OEBB. We look forward to providing you and your family members quality health plans with robust programs and services. In this video, we will review the medical and pharmacy plans available for your upcoming 2018-19 plan year. We will also go over a few benefit changes that will take effect October 1. We'll end with a brief overview of some of Moda's resources available to you and your family. First, let's review the types of plans and network options available. Moda offers two types of medical plans for you. The first type is a Preferred Provider Organization Plan, or PPO for short. The PPO plans, which include Birch, Cedar, Dogwood, Evergreen, and a new high-deductible health plan, FIR, use Moda's Connexus network. This is one of the largest PPO networks in Oregon. Through its robust network, Connexus provides you freedom of choice and access to care statewide. The other type of medical plan we offer is a Coordinated Care Model Plan, or CCM for short. CCM plans offer lower premiums and out-of-pocket costs, coordinated provider choice, and active medical home engagement to collaborate with you on your healthcare needs. CCMs have the same services as the PPO plan, but premiums cost you about 10% less because providers are agreeing to be accountable for keeping you healthy by coordinating your care. CCM plans are paired with either the Synergy or Summit network. Synergy and Summit are regionally based plans that help coordinate your coverage through your selected medical home. The Alder plan is available as a CCM plan option, in addition to Birch, Cedar, Dogwood, Evergreen, and Fir. There are no changes to the deductibles, out-of-pocket maximums, copays, or coinsurance to the existing medical plans. However, the maximum cost share for the existing plans did increase to $7,350 per individual and $14,700 per family. Keep in mind, the out-of-pocket maximum includes deductibles, coinsurance, and copays, while the maximum cost share includes additional cost tier copays, pharmacy copays, and coinsurance. Please note there are no changes to the medical out-of-pocket maximums. We are also offering a new high-deductible health plan called FIR that will have a $2,000 individual deductible and a $4,000 family deductible. This slide provides a high-level summary of both the CCM and PPO plan options and some of the more commonly used benefits. These benefits did not change from the current plan design, so these should look pretty familiar. The Alder, Birch, Cedar, and Dogwood plans are your more traditional style plans, meaning they include copays for certain services, such as primary care office visits and urgent care. The Evergreen and Fir plans are high-deductible HSA compliant plans. On these plans, all services, with the exception of specific preventive care services, are subject to the deductible. Note, new for the 2018-19 plan year, you are no longer required to pair Moda's HSA compliant plans with an HSA account. It's now optional. To learn more about the Evergreen and Fir plans, be sure to watch the separate video available to you on OEBB's website. This slide provides an overview of the pharmacy benefits for the Alder, Birch, Cedar, and Dogwood plans. The pharmacy copays and coinsurance in place today will remain the same for the new plan year. The copayments for the value and generic tiers, as well as the cap for the preferred tier, is lower on CCM plans than PPO plans. Also, on the CCM plans, your pharmacy expenses accrue towards your medical out-of-pocket maximum. For the PPO plans, the pharmacy costs accrue towards the higher maximum cost share. This means you could have lower out-of-pocket costs on the CCM plan. Again, the maximum cost share includes additional cost tier copayments, pharmacy copays, and coinsurance, as well as all eligible medical expenses. We also want to remind you that because the Evergreen and Fur plans are HSA compliant plans, the prescription benefit works a little differently. Pharmacy expenses are subject to the plan's deductible, which means you'll have to meet your deductible before the plan starts to pay. Once the deductible has been met, the plan will pay 80% of the cost, leaving you a 20% cost share. You should still present your insurance card at the pharmacy in order to receive preferred pricing for medications. Value tier medications have a copay benefit that is not subject to the deductible. Moda is moving to a high-performance formulary to help you save money on high-cost drugs that have a lower-cost alternative that is equally safe and effective. Certain medications that have been identified as potentially unsafe to change will be grandfathered for your continued use. For example, seizure medications, mental health medications, blood thinners, and others will fall into this category. You and your providers can apply for a formulary exception when a lower cost alternative is inappropriate for a health-related reason. You can now purchase your medication up to a 90-day supply for all tiers at any participating Choice 90 retail pharmacy through the Choice 90 program. The retail 90-day supply will have 3 copays. The mail order benefit will continue to have 2 copays for the 90-day fill. Generic statins are covered at no cost sharing for members 40 years old and older based on the recommendation by the U.S. Preventative Services Task Force. There are a few benefit changes taking effect October 1 that we want to make you aware of. Nutritional therapy is covered for all eating disorders when medically necessary. Vitamins and minerals are only covered if they are not available without a prescription. You can get urgent care right from the comfort of your home. Virtual Visits connects you with a licensed OHSU doctor, physician assistant, or nurse practitioner through a computer or mobile device. Virtual Visits can be used for a cold, sore throat, stuffy nose, the flu, congestion and nausea, as well as allergies, poison ivy or oak, bites, stings, and more. As a Moda Health OEBB member, you'll receive the Virtual Visits benefit for a $10 copay, which is not subject to the deductible. If you are on the Evergreen and Fur plans, you will have a $10 copay after the deductible. To schedule a virtual visit, go to ohsu.edu/virtual visits. You will be asked to use an OHSU MyChart account to access the virtual visit benefit. If you do not have an OHSU MyChart account, you will need to create one. All CCM plans require members to pick a medical home, the place you will go for all of your healthcare needs, for each covered individual. Your medical home will need to be communicated to Moda. Each member enrolled on the plan may choose a different medical home. You do not have to pick the same medical home for the entire family. You must use your medical home for all primary care services in order for your benefits to pay at the in-network level. Primary care includes internal medicine, family medicine, general practice, geriatric medicine, and pediatrics. If you receive primary care services at a clinic that is not your selected medical home, benefits will be paid at the out-of-network level. Keep in mind, obstetrics, gynecology, and women's health can be utilized outside of the medical home, but the provider must still be in-network in order to receive in-network benefits. If you enroll in a CCM plan, you will receive a medical home selection guide along with your ID card. This will provide directions on how to pick your medical home through your MyModa account. If you are currently enrolled on a CCM plan and have already chosen a medical home, you will not have to do anything unless you want to change your medical home selection. Keep in mind, you can change your medical home anytime during the year. The updated medical home will take effect the first of the following month. To learn more about the CCM plans, be sure to watch the separate video available to you on OEBB's website. Now, let's review some of Moda's online resources available to you and your family. First, we want to remind you that Moda offers you an OEBB member website. You can access this site at modahealth.com/OEBB. Here, you will find more information and resources like plan documents for the upcoming plan year and access to your own MyModa account. This is also the place where you can access Find Care, Moda's online provider directory. Your MyModa account offers you a number of tools and resources, including access to claims and electronic copies of your explanation of benefits, or EOBs. You can also download your member ID card and access our health coaching programs and healthcare cost estimator tool. The cost estimator tool allows you to get an estimate of your out-of-pocket costs for certain medical services. This online tool gives you an estimate based on your personal health benefits. This is also where you can sign up for a medical home for each covered member in your family if you enroll in one of the CCM medical plans. Find Care is a great tool, especially if you are considering changing to one of the CCM plan options. Use Find Care to see if your Connexus contracted doctor also participates in the Synergy or Summit network. Be sure to use the Search by Network option if you are trying to locate providers on a different network than what you are currently enrolled in. You also have access to The Well, a quarterly digital magazine created just for OEBB members. Here, you'll find a variety of articles and videos that we hope you find interesting, informative, and relevant to you and your benefits. We also want to remind you about Moda's customer service teams and that we have OEBB dedicated phone numbers and email. Customer service is available Monday through Friday from 7:30 a.m. to 5:30 p.m. Thank you for taking the time to watch this video. We hope you found this information useful in helping you make your open enrollment decisions.